Let's talk about the procedure for blood transfusion, right? So the step-by-step ways in which what blood is transfused in the hospital. All right. So first of all, what is blood transfusion? Blood transfusion is a procedure in which donated blood, okay, or certain components of blood are put into another person's body. All right. So it could be whole blood, or it could be other components like it could be plasma concentrate, it could be platelet concentrate, it could be concentrate of some specific what um, clotting factors. All right. So from another person who's a donor, you put it into another person who is a recipient. All right. So talking about the procedure for this, first of all, you should ensure that you collect the blood sample and you group it and you cross match it. Make sure that what you are having from the donor is the same thing, is the same blood group for the recipient to avoid all those adverse blood reactions. You won't like to see that, all right? Now, you should also ensure that the request forms are well labeled, okay? Now, retrieve the cross-matched blood from the blood bank, ensuring proper documentation, okay? You tell them that, okay, I've already taken this blood to so patient, okay? So this will ensure that there's proper documentation in the hospital. So this should be warmed before transfusion. So you can just warm the blood a bit, okay? There are things for warming blood in the blood bank. So you warm it a bit just before transfusion. You should obtain informed consent from the patient and cite a wide bore cannula. So even before, you know that the patient needs blood. If the patient is conscious, just try to ask for their consent. If their relatives are there, try to ask for consent. Do you know why? There are some patients that might come to the hospital and the type of religion they practice does not allow for blood transfusion. Okay? So you might not want to actually go against that. Okay? You might not actually want to go against that. So you just what? Try to do this thing like ask for their consent. Now you should obtain baseline vital signs. Okay? Cross-check with a second healthcare worker that the blood unit number corresponds to that of the patient that is intended for. Okay? Now, run the blood transfusion through the appropriate blood giving set, slowly in the initial 5 minutes and faster thereafter for about 2 to 4 hours. Right? Vital signs should be recorded at intervals within the periods of what? Transfusion. So you check if there's any discomfort in the patient during transfusion and all the stuff, right? You record them. Now, if there are any signs of a transfusion reaction, like fever, allergy, difficulty in breathing, jaundice, you should stop the transfusion immediately. Okay? Collect blood from the opposite limb and send with the hung blood back to the lab. That's when there's reaction, okay? Just for them to do a recross matching. Because how far? He told me that this blood actually matched with the patient's own, but I'm transfusing it and it's basically bringing up some reaction. So you cross match. So other investigations include blood culture, serum-free hemoglobin, bilirubin, and urinalysis, okay? Now you should give normal saline, antihistamines, steroids, and monitor urine output. That's in cases of what? Blood transfusion reactions. Okay, so this is what procedure or procedures for blood transfusion. Okay.